Cancer. Most of the times we wonder, is there a way to catch it early? Yes, screening is one of the tools whereby you can catch cancer early. And why is that we don't hear much about it? There are two reasons. There are only a couple of cancers where cancer screening is effective. Let us talk about them. The first and foremost is cancer cervix, which happens in females predominantly in the postmenopausal age. The seeds for this cancer are laid around 20-30 years earlier. That is, the HPV infection is responsible for causing cervical cancer. The human papillomavirus, which when infects the cervical region of a female, takes around 20-30 years to cause cancer. Now what do we do about it? Any female who becomes sexually active needs to undergo a Paps Smear followed with HPV testing. This Paps Smear and HPV testing, if done, is able to catch hold of pre-malignant lesions or something called as CIN. If the Paps Smear is normal, then the person need not have to bother for 3 to 5 years, and it can be repeated after that. If you get this screening program in place done properly, CS cervix can be completely eliminated like in Scandinavian countries. The next cancer which I'm going to talk about with respect to screening is breast cancer. Ideally, mammograms are advised starting from the age of 40 every year. Getting the mammogram done can catch hold of, say, a breast in stage 0, and complete cure can be expected. The next in the list of cancers where we can do screening and prevent deaths are colon cancer. What do we do in colon cancer? From the age of 50, you could get a colonoscopy done or a fecal occult blood testing done. So these three cancers, CA colon, CA cervix and CA breast, are the ones where cancer screening makes a big impact. The other two cancers where again screening has some role, and let me mention about them. One is CA prostate. After the age of 50, getting a PSA test done regularly can catch hold of CA prostate at an early stage. And then if you have been smoking very heavily, today we advise CT scan of the lungs to detect lung cancers at an early stage. Get in touch with your doctors to understand more about how screening can save life. In India, we have the bane of tobacco usage, and therefore we can probably prevent oral cancers if people go to the dentist or to the ENT surgeon and get their mouth and throat checked on a regular basis, especially who have chewed tobacco for a longer period of time. Cancer is curable if treated early and much better if prevented. Thank you.